A very good evening, my dear students. So here we are to discuss about the Rajasthan MO 2024 paper for the subject of pedodontics. I am Dr. Anaya Kulkarni, your guru for pedodontics from DBMCI. So in the Rajasthan MO paper this year, we had only three questions related to pedodontics. So we are going to just discuss about these three questions. Simple questions, very easy questions. So let's just go through. The first question that was asked was, in conscious sedation, nitrous oxide and oxygen is given in the ratio. So here the first thing that you must carefully read is, in what are they asking, whether it is nitrous oxide first or whether it is oxygen first. So they are asking nitrous oxide to oxygen ratio. So how much concentration maximum you can give for nitrous oxide, and how much maximum or how much minimum can be given for oxygen. Okay, so that they are asking. So in what ratio you can use it in the conscious sedation. So the answer here is answer C, that is 60 to 40. So you can use a 60% concentration maximum of nitrous oxide and a 40% concentration of oxygen. So basically, this particular is the picture of the setup that is there for the conscious sedation, the nitrous oxide used in the dental practice. So there are two cylinders. The blue cylinder marks the nitrous oxide cylinder, and the green cylinder is that of the oxygen cylinder. So what you do, you select the particular correct size of the mask for the child, and then once you put on the mask of the child, first you flush 100% oxygen. Then eventually what you do, when the patient is comfortably sitting, you turn the knob such that you turn the nitrous oxide to 10% nitrous oxide, and 90% oxygen automatically occurs. So once the patient is still comfortable, eventually, slowly, you progress to 20% of nitrous oxide. That makes 80% of oxygen automatically. And that is how you go on increasing 10% of the nitrous oxide gas. So what you have to do is, you have to notice the symptoms that the patient is conveying to you. There are certain patients who will show you proper conscious sedation symptoms at even 30% concentration of nitrous oxide. Some will show at 40%, and the maximum amount of nitrous oxide that you can give. So once the patient has started showing, symptoms of angiolysis, symptoms of relaxation, of euphoria, whether even if it is at 30 or 40% of nitrous oxide, you must immediately stop there. You must not increase nitrous oxide anymore, and you can start the procedure. If the patient requires more, the patient is still not showing any symptoms, you can go further. But the maximum amount of nitrous oxide that you can pass through this in a patient is 60%, and 40% of oxygen should be continuously running through. So the answer is 60 to 40 ratio of nitrous oxide to oxygen. Answer here is C. So that brings us to the next question, that is question number 2, which was asked, Colorado stain is seen in which dental condition? So very, very easy, straight pick from our lectures, from our notes. It's a completely straight pick. The answer here is not caries, not malocclusion, not calculus. The correct answer is fluorosis. Okay, so there is a reason why it is called as the Colorado stain. So there was this person called as Dr. Frederick Mackay, who graduated as a dental student in 1901, and started working as a dentist in a place called as Colorado. So while he was working as a dentist in this place called as Colorado, he accidentally found that a lot of patients have brown, ugly stains on the teeth. Okay, so earlier also, while he was studying dentistry, he would have come across patients, and he thought that he has never seen such type of stains on the patients in other areas. So he concluded that there is something specific in this particular area that is resulting in these ugly brown stains in the residents of the place called as Colorado. So because he did not have any further information as to why this is happening, the only thing he knew was this is specific to this particular place. He had not seen these stains in any other place. That is why he named these stains after the place he found it in, and that is why he called the stains as Colorado stains. So later, after further discovery, further studies, analysis, and everything, it was discovered that the Colorado stains are actually fluorosis stains, and hence fluorosis was earlier named as Colorado stains when it was first discovered by Dr. Frederick Mackay in the year 1901. Okay, so that brings us to the third question. And what is the third question? The third question was, what is the recommendation for use of fluoride dentifrices in children aged 4 to 6 years? So what is the recommendation? So they've given very, different sort of options here. So basically, when you go through the EAPD guidelines and even through the AAPD guidelines, what they say is a child needs to brush with a fluoride toothpaste twice in a day. Okay, so according to the EAPD guidelines, from when the first tooth erupts up till the age of 2 years, the patient is supposed to brush twice. He can use 1,000 ppm fluoride toothpaste, but the size of the toothpaste that is put on the brush should be as small as the grain of rice, or they also call this as a small smear layer. So a very small thin like smear like layer can be used, but twice daily the child should brush from the day the first tooth erupts up till 2 years of age. Then for 2 to 6 years, a child can use 1,000 ppm, or according to, if for example, if there is excessive fluoride in the drinking water in the area where the child is residing, then the ppm of fluoride can be reduced in the toothpaste. So again, twice daily is recommended with a pea-sized toothpaste, and over 6 years, twice daily with a full length of the brush, the toothpaste should be used. So that is the recommendation. That is the recommendation that is given by the European Academy of Pediatric Dentistry, and the American Academy of Pediatric Dentistry guidelines say that a child of 3 to 6 years of age should brush twice daily using a fluoride toothpaste. So because they've given options like that, so the most legit option that is given is twice daily with fluoride toothpaste and once without the paste. That means once he can clean, because of the in-between meals that the snacking that the children of the age group 3 to 6 years do. So if they're snacking in between, they can just run a brush across their oral cavity without using a toothpaste. But twice daily brushing with fluoride toothpaste is recommended by the American Academy and the European Academy of Pediatric Dentistry. So these were the only three questions that were asked in the the Rajasthan MO paper in of 2024. And I hope it is pretty clear. The questions were simple, direct picks from our lectures and notes. And still, if you have any doubts, please in the comment section, you can share your doubts and we will clear it as soon as I look into your doubts. Thank you so much.